All right, we'll go ahead and get started. Andrew is joining me as a co-host this morning or evening because Andrew is in Sydney. So I am a physical therapist and I am passionate about helping people with chronic back pain. And Andrew is an exercise physiologist in Sydney. So, we are both pretty active on the Reddit group, and we decided to create a podcast called Stabbed in the Back. And the reason is, the medical system at large often makes people feel, when they go to get treatment or interventions or information for their back pain, they're often left feeling lost, hopeless, and maybe sometimes even more fearful. And I don't think it's like the medical system at large is like that's their intention, obviously. And we can get into iatrogenic, you know, uh, these medical system causing more harm to people through either narratives or treatments that aren't actually as helpful. So the goal of this podcast is really to bring on guests who have essentially conquered their back pain and through their stories, sharing their experiences, hopefully resonating with other people who have similar symptoms or similar experiences who can then find hope to their own, I hate to say journey because it's a little corny, but journey on overcoming their back pain. So, Andrew, just to introduce yourself just a little bit and what'd you do today? Because I know it's evening and it's almost your bedtime.
Oh, yeah, pretty much just went to work and working with people who I guess are aligned with like my interests, which is like the world of chronic pain and the one of the most common ones worldwide is like low back pain. So, yeah.
And
Um
for people who are maybe not familiar with an exercise physiologist in Sydney, because it's a little different in the States, what is it that you do exactly over in Australia?
yeah, so I think exercise physiology, it's a quite a new profession, and I think straight out of university we're trained for more so uh the I guess the age related changes to our health. So that might be chronic conditions like diabetes, high blood pressure, osteoporosis, osteoarthritis, or even some neurological conditions. So that might be Parkinson's disease or people who suffered a stroke. It's like just rehabbing people through the use of exercise as a form of medicine and just getting back to doing what they want to do. That could be through like simple tasks or chores around the house. And probably like the most important thing is like getting back to the things we love. So that might be for parents getting back to playing with their children, or for the younger folks, it's like getting active again, getting back to running and everything there.
So in the States, we have physical therapists, and pretty much everywhere else around the world, we have physiotherapists. And then I know you have physiotherapists in Australia. So what is maybe the fundamental difference between exercise physiology in Sydney and then a physiotherapist in Sydney? Like, what would be
Mm,
the main difference?
yeah, so I think overall, it's like I specifically say out of uni because after university, you can always upskill in whatever area you're interested in.
Hmm.
So out of uni, physiotherapists are more focused on musculoskeletal conditions. So that could be just like uh, muscle or tendon and joint pains and stuff like that.
Okay. Yeah. All right. Well, so the guest we have today, her name is Rachael. She's been very. I'm very grateful that she decided to come on here and share her story because I have worked with her personally, but I think her story is a familiar one that I hear a lot about trying many different things to overcome back pain and really sometimes feeling like you know option A, B, and C didn't really help, and then it's taken some time to finally have some relief. And so I'll go ahead and we'll just bring her on and get going. So how do I do that? Hi, Rachel.
Hi. Hi.
Super excited to start this podcast, and also very grateful that you volunteered after I asked to be the very first person to come on here. So just to get started, like just introduce yourself and maybe any part of your story that you want to share that might resonate with other people, or give just like a quick picture on kind of your experience on not just like diving into back pain, but just who you are and what do you do?
Yeah, so I am an almost 42-year-old mom. I have a long history of being like active and working out's always been a huge part of my life. And I think, when I was younger, maybe we all do this, but you do a lot of stuff that's not maybe not great for you, but you bounce back quickly, right? So you're working out more intense, but you shrug it off and those things, those aches and pains, they don't seem to add up. And then I feel like I got to a point where I was like, wow, it's just, the pain is not really going away, right? So it's starting to affect my daily life. And that was, I guess, has it been a year now since I first saw you, Andy?
Yeah, I think
Yeah.
it's been a little over a year. Yep.
Yeah. So before I came to see you, I guess I had been kind of struggling with this low back pain for probably 6 months, maybe before I was even like, oh, this is like a thing that I should probably really address because I had been so used to just kind of shrugging off pain. But, I have a young kid and it's like I couldn't really do the things that I would normally want to do with him. Um, and it was affecting my ability to do, gardening and things that I typically enjoy. I really couldn't do deadlifts or any kind of hinging movements without huge flare ups. And so I was thinking like, wow, I think I maybe need to like see somebody. And I had been in physical therapy before, so I thought that'd be a good place to start. And I'm trying to think of how I found you. I think it was an ad on Instagram actually.
Hmm.
Um, Maybe through the algorithm. I do follow a lot of physical therapists weirdly. So maybe it was like I was the target. So an ad showed up on Instagram and it was like a free screening or something like that. And I was like, you know what? And I saw kind of like a clip of probably just you guys in the gym. Or I was like, oh, this looks like maybe something more up my alley. So I just filled out the form and that's kind of like how I got there, I guess.
Yeah, I think
Yeah.
don't ask me how the algorithm
Yeah.
works. But it definitely targets people who are maybe looking at content, or even if you Google back pain, like
Right.
and some keyword. Anyway, I'm like now explaining what ad targeting is, but that's not
Yeah.
really. I told you. I just said I don't know what it is, but no, I think that was a good intro. So, just what's your history of exercise? Like, what were you into before you had back pain? And and like, what did your like day to day usually look like? Were you working like a lot on your feet, or what was like your total activity?
Yeah, so I guess we think about like adult history of working out. I was on the swim team in high school and stuff, so there was, that part of my life, but I kind of had like I don't know, I was kind of not doing any kind of programming or anything until I found CrossFit, of course, in like 2010 maybe. Um that it was like, really up and coming at
Mhm.
that time. And I drank the Kool-Aid and I started really doing that a lot. And before that, I was just kind of like doing random classes at the Y, but I started doing a lot of CrossFit, like one of those like 6 day a week. Sometimes, you'd be just sitting around stretching and people would be like, oh, you want to do this other WOD with me? And I'd be like, yeah, even though I'd already worked out. So just doing like really high intense stuff. And at that time, actually, I had been laid off from my job. So I was literally doing nothing else but working out.
Mhm.
So I did that for a long time before I started my kind of, I guess, second career, you could call it, which is content creation, copywriting, things like that, freelance. So in my day-to-day work life, it's quite sedentary because, I'm typing at a computer. And so I guess I'm kind of one of those classic cases of like you have your 9 to 5 and then you work out for an hour a day and you think you're active, I guess. But I do walk a lot. I try to get, my 10,000 steps. So it is but it's hard because I'm not, on my feet for my job. It's mostly just in the gym. But after I had my son, I wasn't able to really return to CrossFit in the same way that I was doing before because you have to actually function the day after and take care of a human and you can't be like not able to move. And then also CrossFit gyms are just notorious for not having childcare. So became more difficult for me to be in that world. And eventually after, I think he was like a couple years old, and I officially retired from CrossFit. There was no party. It was just privately retired.
No, no,
And
no
then I,
confetti. No.
no, there was none of that. It was very anticlimactic, honestly. But I still like to tell people I retired from CrossFit because I feel like you get a certain amount of clout from saying you used to do CrossFit, and I'm really, into that.
Yeah.
So,
Yeah.
but yeah, I mean, CrossFitters, you know how it is.
Yeah, so I was just gonna say, and I don't know if Andrew's got any experience kind of dabbling in barbell lifting or CrossFit, but like I definitely, the reason I became a physical therapist was Kelly Starrett was on YouTube in
Oh yeah,
2010
yeah.
and 11. It was like I think
I have his
CrossFit
book.
peaked. Oh yeah, I've got two of them, but I know that
Yeah.
uh, CrossFit, I think if you look on the internet, it peaked at like 2012 or something, or 2013, 14 in terms of like searches. Could just be pulling that stat kind of out of my butt. But, um, I definitely got into it as like my first experience lifting. And I remember thinking, why is this person's ankle not moving like that person's ankle? And I saw Kelly Starrett and I was like, what's a physical therapist? And I definitely, when I worked at my brother's gym, as a CrossFit gym, and I taught classes, but when I left, I couldn't find a gym that could replicate the same mindset. So like,
Yes.
I
Mhm.
can't like bash CrossFit. And I know each, cause that's kind of my origin story, but like, I know each gym has their own protocol, and every gym after I left my brother's, whatever city I was living in, was trying to kill me. And,
Mhm.
so I just sort of, and I actually hurt my back, not in a CrossFit gym, but barbell lifting. And that's my whole story, is I took 2 years basically to figure out, um, why my back was hurting, and that's for another time. But I definitely drank the Kool-Aid as well. So I think you're right. This like, oh, I did CrossFit, and it can be safe, but it's one of those things where I can't really bash CrossFit because I would have never become a PT if I hadn't. But
Yeah.
so
Yeah. For sure. I mean, it was a great time of my life. I think it's just one of those things that sometimes it doesn't fit in all phases of life. And I started to realize that the goals that I had in my daily life, it just didn't match with the, competitive aspect of CrossFit. And especially because I had moved cities, and I kind of, like you said, it's hard to match the vibe of, your OG gym, that you just really never find the same type of, I don't know, like the people are different, and like the workouts are different. They're geared for, some gyms are more competitive, some are more just like general fitness. And I didn't find really a good match after I moved. And then, with my son, it just kind of was like a natural transition out. But I still love the concept in general, but yeah, it wasn't working for me anymore. The intensity was just too much. And in that environment, you can just easily push yourself beyond what may feel safe for you at the time. So it's kind of like that's the main reason I left. And I started pursuing more of your classic, I guess you'd say, bodybuilding after that. And so I've been doing that consistently, I would say, for about 4 years now, where I just go in there and I do that boring stuff that nobody wants to do. I'm in there with the dumbbells and the cable machines, and I got leg day and arm day. But some of my programming still includes barbell lifts, and the deadlifts or RDLs. Those were the things that were really bothering me. And I used to really love deadlifting. And then that's kind of when, I came to see you. I was like, I can't deadlift.
mhm.
And that was really bumming me out. And then on top of that, in trying to like kind of do some fixing on my own, was seeing, other professionals, and their party line was basically stop deadlifting, which I know specifically stop deadlifting is a very common response. That movement seems to be very controversial. And I'm like, well, I deadlift my son. He's 50 pounds like every day. So
Yeah.
like, I can't really stop, but it'd be great if I could, maybe get some help to get back into it. I don't know. So that's kind of how I came to you. And we were working on just getting my deadlift back, essentially.
Yeah, for sure.
Go ahead, Andrew.
Yeah, I feel like there's sometimes a huge disconnect between like the person that's trying to help you and like what you need to do in everyday life, right? It's like if you're a
Yeah.
mom, you're gonna be carrying a kid a lot and picking them up and playing with them. So it's like I want to learn how to squat or deadlift or carry and just do normal mom stuff, right? So it's like these like quote unquote scary movements, they're like so basic to like just being a person. So
Yeah.
yeah,
Yeah.
it's really sad to hear when like a physical therapist or an exercise therapist might be like, oh, you should stop doing that movement because you might have hurt yourself doing it. So it's like, oh yeah, that's bad, can't do that anymore. But it's like,
Right.
but I need to do it, right? And then yeah.
I think
Yeah.
that's where the term, like I mentioned in the opening, was like iatrogenic, and it's just relating to like the any advice or intervention or treatment that you get, which we'll probably talk about some of the lower evidence supported treatments, which I still think have merit, but it's sort of a lot of narratives around those treatments that I tend to have the problem with. But the iatrogenic is essentially like inadvertently what somebody can tell you can actually lead you to more fear, which then leads to the side effect of not building up a tolerance to deadlift your son. And so it's kind of like when we tell people stop deadlifting, while it's very individualized, Andrew and I talk a lot lately about how the cookie cutter treatments are not going to get people back to deadlifting if you're doing these low level activities. But just from the outset, your narrative really matters. And so did you feel like, I mean, you knew better, it sounds like, going into some of these situations where somebody would tell you stop deadlifting and you're like, I'm not going to
Yeah.
do that.
Sounds
Yeah.
Right.
fishy.
Yeah, I mean, I guess it's part of it's just in my nature. I sort of question everything, but because when you have a long history with movement and you're like, it just wouldn't make sense, right? Like I've been deadlifting for at this point, what, 20 years almost. Like all of a sudden my body's like, oh, that's not good anymore. It didn't really make sense to me that that would be the single root cause of my issues. And so, in that way, I, of course, immediately didn't really stop deadlifting, but I started trying to like, go lighter or like rest, not do it as often, right? Rest more. And then, of course, I tried all the like classic, you know, kind of physical therapy type exercises you see on the internet, which is, the next place people go is like, what do I do for back pain on Google? Um,
Clamshells.
Clamshells,
More
yeah,
core, more glutes.
a lot of that. My core was unstable and weak, which actually, I mean, it might be fair because I did have a baby. I mean, those things depends on the person, obviously. But so when those things kind of failed to resolve the issue, I was like, okay, well, I guess I can't really fix this totally on my own. But then you're kind of like, well, what's the next step? And is it so serious that I need like imaging or, it felt more like a muscular issue that could be resolved without involving, like an ortho so I would never want to start there anyways, but I was like, okay, let's go see a physical therapist and see what they have to say. So, yeah.
I was like, you're fucked. I was
Yeah.
like, you're
He
no.
was like,
No.
stop deadlifting.
How quickly did we start deadlifting?
I think we did on the like maybe the second visit. But I think we had like some weird fluke where it was like two moves like completely solved it in a week.
Yeah, that
Remember
doesn't.
that? And
Yes,
then
and
he was like, "I swear this never happens." And I was like, "Okay, voodoo." Like, "Okay."
I was like, "Do you want your money back with
Yeah,
the 8 remaining sessions that you
right.
bought?" Yeah,
And
it
I was like,
doesn't.
"Don't worry, I'll injure myself again. Don't worry."
Yeah, I think we were like, all right, what else is going on?
Yeah.
And so that was easy to get back into deadlifting. But I think for your case, that one movement was, and my approach is, hey, you're missing this type of mobility. Let's give you more options. Because, if you're only able to move a certain joint, this is where, not to go on a side tangent about like, I've swung from pain neuroscience to biomechanics back and forth, and you'll get people online who will hyper focus on one or the other.
Yeah.
And and I've always just said it's not always, but more recently I'm saying more and more, it's all considered biology and it's all at interplay. So, everything is fair game, but at some point, if you can educate and address some of the, we call it psychosocial factors where you're like, it's okay to deadlift. And then you get a little bit of reassurance and hope, then you can transition to focusing on maybe some of the things that are missing biomechanically, which in your case, it was like, I think you had some hip rotation and that was
Yeah.
missing, and your shin bone wasn't quite rotating a certain way. And it's like, I don't know if that's like, if I could have definitively said at that very moment, like, oh, this is your problem, because I don't know until we try things. And so it was like, yeah, we unlocked or whatever. We just got the joint to move a little bit differently. And you did that for like a week, a couple times a day, probably. And then you came back and you're like, well, it's gone. And even I was like, all right, well, shit.
Yeah, I think that's
Like,
like a
that's so
little bit
weird.
of yeah. I think that's like a little bit of the art of like, I guess, medicine or healthcare. It's just like the practitioner working with the person in front of us and exploring things together and like figuring out what works for you specifically, right? And like when we kind of explore things with you, it's like you might be giving yourself permission. And I think that's such a big thing. Like some people, like, my shoulder hurts, I've got a scan, and they say I have a full thickness rotator cuff tear in like this one muscle. Now I can't use my shoulder ever again. It's like, have you tried? And they're like, I haven't used my shoulder in 6 months and it still hurts. It's like, okay. And then when I do see them, it might be like, okay, do you want to explore lifting up your hand a little bit higher? And they might be literally just them exploring and just giving them permission to use their shoulder. They're like, it hurts, but it's like, I actually can do it. And then practicing that within a session, they're suddenly like, oh, it actually hurts less now since I'm using it more. And then I'm like, I
Yeah.
don't know. I was like, this is so cool for them. It's like, it's such a great learning experience. And there's so many little things that are probably going on that I can't like explain in a sentence, but it's like, okay, it's cool that you having that permission to use your body in whatever the way you want to is like, it can be really beneficial.
Yeah, I think just somebody, who's, an expert or, doctor, if you will, telling you like, yeah, it's most likely fine for you to move, this part of your body when you've basically been like, I'm scared that any movement is going to like injure me further, or, you just don't really know where that line is. And that permission is huge, because you're like, oh, okay, like it's something that I can work through and not something that's just like a roadblock where you're just like stop everything. So that was definitely part of it, I think, where the approach of like, just okay, well, we can get you back to deadlifting, let's try some movements and see how they feel, talking about like the pain scale and that it's okay to have a little increase in pain after a movement and then have it come down. Just understanding that helps you find the line, and I think it gives a sense of empowerment of like, oh, I can do this, which is not, I mean, honestly, it's not really the approach you get from a lot of places or people, a lot of fields, I guess, because the interventions are more like, well, you need surgery, or yeah, so, or you get like a diagnosis, and then once you get that diagnosis, that's all you can think about.
Yeah. I think it's like that, looking for a fix rather than looking how to work with it and seeing small improvements over a longer period of time. And hearing that
Yeah.
isn't sexy, right? It's like I have the silver bullet to get rid of it in this one perfect magical exercise. It's not always like that. And it
Yeah.
does take time. But yeah, and everyone's so different as well. Some people take a few months, a few years, and other people are like, oh, I feel better right now. This is like crazy, just because it's like everyone's built so differently.
Yeah.
I
Totally.
think I come back to this quote, and it's not like I don't even know who this, I'll be honest, person is, but it's medicine is the science of uncertainty and an art of probability, says Sir William Osler, a father of modern medicine. So like, I haven't really been read up on that gentleman, but it sounds like he's the father of medicine is pretty, or modern medicine is a pretty it's a pretty strong label there. But
Yeah.
it's this idea that there is a science of uncertainty, meaning there's like lots of possibilities, and then if you work into this art of probability, you're basically saying, you know, like being comfortable being like, Rachel, I can't tell you structurally what's wrong with your back, but the probability of it being super serious is very low. That is where you start to go. And I always say 80, I don't know, 75, 80% of my job is really just giving people hope and reassurance that it's probably okay. And you can talk about the different conditions and the strategies, whether it's like a radicular issue where you've got pain, nerve related, kind of running down your leg, or if it's more like that muscular, maybe strain. There's different approaches, but for you, it being more muscular or a ligament strain of some kind, was there a tipping point in which you were like, it's kind of not just stopping me from training, but it's kind of bleeding over into my
Mm.
day to day? And what did that look like?
Yeah, I noticed that I just really couldn't sit. Like, so I couldn't sit on a park bench with that didn't have a back, in which you start to notice like, wow, I spend a lot of time sitting on park benches because I have a young son who's like always at a park. So I was like, I felt really sore anytime I would sit, on a hard bench for like a couple of hours. And then yeah, like gardening, anything where I was like trying to bend over for a long period of time. Um, I really just was not able to tolerate it that well. So yeah, it didn't just affect me like in the gym. It was definitely starting to be like, something is not like not being able to train is one thing, but when you can't like do your normal stuff and especially sitting, I'm like sitting it literally requires no energy. So the fact that I couldn't sit on a bench was pretty sad. So yeah, that was really the tipping point, I think.
Had you had back pain prior to like, I mean, those that 6 months where you experienced it in your life? Did you have back pain at any other moment you can think of?
No. I
Okay.
was it was unusual because I feel like for the length of time that I did CrossFit, I never really sustained any significant injury. So it was mostly like um the overuse kind of stuff where it clears up. And I had never like quote unquote tweaked my back before then. I had never like thrown out I don't know, people use all these like phrases, thrown out my back, tweaked my back. I had never experienced that before.
Mm.
And so it was kind of this chronic, like simmering muscular pain that was new. But
Yeah,
it wasn't like it didn't feel like it was like an acute injury. Like
yeah,
there was nothing, yeah, there was no like immediate onset. So yeah, that was new for me.
yeah. How do you make sense of that? Isn't that like super weird to
Yeah, it's super
like the
weird. And then for
normal
somebody to be
person?
like, yeah, they're like, oh, it's because you're deadlifting. I'm like, probably not though. Cause like there was no, some people do, like, if they're deadlifting and you do sometimes experience that, like, moment of, "Oh, I've done something." That was never the case for me. It was just kind of like this slowly creeping up, kind of feeling, and for a while, I actually thought it was my hip because it's only on one side, and I was like, "Is it hip pain?" And then I think you actually were the one, Andy, you were like, "It's your back, like, it's your low back. That's your low back." And I'm like, "No, but I think it's, like, kind of on the side like my hip." And he's like, "No, like, that's your back."
I have like a quick story. I was working with somebody virtually for a while, and they were having back pain. But then they was kind of talking about hip pain, and they were like, "It's my hip." And I virtually never asked them to point to like their hip. I was just like, "Oh, do you understand it's your hip? I understand it's your hip." And she actually she was from a country in like Eastern Europe. It was like not Yugoslavia. It was like Bulgaria. Super super great. She was young. She was super awesome to work with. But one day I was like, after like 4 sessions, I was like, it's not getting better. And I'm like doing all these things. And I'm like, and this is just like a learning moment for me. And I don't mind being vulnerable telling you this. But I was like, can you point to your hip? And she was like pointing to her groin, which is technically your
Oh,
hip.
no.
But
Right.
I was like thinking when she told me, since it's virtual, we are kind of limited to what we can do. I mean, I should have had her point to where it hurts from the start, but yeah, sometimes we're like, that's my hip. And I'm like, well, actually, I think that's, that's your groin, like, adductor area, like, so it changes your approach. If you think, if you think it's your hip and you're working on doing all these hip exercises, and then you're like, oh, that's actually your back, but it's all very hard to separate, honestly. Um, so when we started to, when you had that set, those two exercises that I gave you and you felt much better, um, you know, it's been over a year. I think you mentioned back pain hasn't totally gone away, or has it?
I have times where it's completely gone. And then I'll have times where I'll have like a little flare up and I'll start, I'll do the things that worked before and it usually resolves. Um, so, I feel like that's, I mean, for me, that's totally fine. It may be the case that if I was doing those things every day, it would never come back. But who does that? I mean, let's
Mhm.
be honest. So, it's for me, it's manageable, which is like the most important thing is that it's not, I can very quickly address the issue and usually it's resolved, in a few days. So yeah, but
Is
I would
it
say like for the most part, it's resolved in the sense that it's not affecting my life in the same way it was.
good?
Yeah.
Yeah. The I always say like 80, the statistic is like around 80% of the adult population in the world will have back pain at some point like in their life. And then that sort of then tells me that it's probably more like the common cold of musculoskeletal issues, meaning like
Yeah.
you're probably going to get it and you're probably going to get it multiple times in your life. There are of course outliers and people who don't, that 20%. But what's interesting is how you've highlighted that it doesn't is not impeding on your life and you can manage it, and that's always the goal. My approach is, and I'm Andrew's as well, is independence is the priority, right? I don't want you coming back to me all the time, which sort of lends into, and we're kind of going back in the timeline here, but what things were you trying that you felt like were helping but not solving the issue, that maybe not making you feel like you were independent on managing it on your own?
Yeah, I mean, probably two of the main ones, I mean, especially for back pain, is people usually seek out like some kind of soft tissue work, right? Some kind of body work. So I definitely did that. I have a guy that I see, like that I had been seeing for years. So of course I asked him about it first. Um, and it does give relief. A lot of times it's temporary. I did feel like, sometimes he would tape me, which did help. I know it's kind of weird. Sometimes it does seem to help me.
Mhm.
Um, just I don't know if it's just restricting, probably just restricting the movement a little bit, but he would tape it, but then it would really never, then the tape would come off and it would kind of come back. And so I didn't really feel like it was addressing the issue because, it I don't think it was just that I had, adhesions or that something was tight. It was like, something different was going on. So that did provide some relief, but it didn't totally fix the problem. And then I also saw a chiropractor. Again, it's a long standing, you know, I've been seeing him for a long time. And similar thing where it might provide, relief for a little bit, but then it would just come back. And those are kind of two things where like you can't do that on your own. So you inherently have this relationship with these providers where you do have to go back, every week or every other week. Which it's not financially sound for most people. I have some because of my work, I have some trade things going on. So it's the only thing that makes that possible. Otherwise, I would not be able to seek, that kind of help. And then, you know, revolving your life around these appointments, which only help temporarily, is not necessarily going to work for a lot of people either. So I do still see both of them, and I think there's value in that. But I also don't think it's like the solve for a lot of cases, just because um, you have to keep going.
Yeah. 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 I think those type of therapies are like they're really good as like a supplemental thing. But it's just
Yeah.
like, what about the rest of your life? You need somebody to like talk to you and like figure things out, to like get back to doing those things, like playing with your kid or whatever, right? I think that's like the missing link with like a lot of, um, I guess, more of the touch-based therapy type of guys. It's like it's
Mhm.
so good in the short term, but it's like if they don't talk to you about these other things, then maybe they're missing something.
Right.
And I'll always say it's I think professions will attack other professions, namely physical therapy, attacking chiropractor, which I always picture um, like an Anchorman when the uh, competing stations, they show up and they're like, nobody touch the hair. Um, I feel like chiropractors and PTs, they're just gonna like show up one day at the playground and throw down. But
They
it's
might.
They might.
I I remember being a student and I remember being like, "What? You can't move bones with your hands?" I'm like, "Fuck those chiropractors." There are good chiropractors out there, right? There
Yeah.
are good PTs out there. There are
Yeah.
it's the to me it's the narratives. It's
Yeah.
if somebody is saying I'm resetting your bones versus oh this feels good and it's helping you manage, that's very different. I go back to the iatrogenic thing where it's like if you feel like, oh, my bones go out of alignment, you're gonna feel more fragile because you're like when it happens, when that pain comes back, you're gonna go, I can't move. I can't go to work today. I can't do this. And you might be having those pains still, regardless if you're, out of alignment or not. Or even if it is, how normal is that? And Andrea, you wanted to add something uh, to kind of like the well maybe the probability of like somebody having and something like a leg length discrepancy or
Yeah, I think it's
anterior.
pretty normal to have like one or like less than 2 centimeters of like leg length
Mhm.
difference. But like the body's so cool. It's like that's pretty normal. I think even Usain Bolt has like quite a few centimeters difference, and he's like an amazing athlete, right? So it's like maybe it's not a problem. It's like
Mhm.
maybe we
Right.
don't need to focus on this, and what we need to focus on is like what the narrative is and everything. It's like cool if massage and like touch based therapy allows you to feel more calm and relaxed and allows you to just move again, then that's such a good starting point, right? It's like okay, cool. Now how about the rest of it's like what's next? It's like the lifestyle counseling part. It's like how's the rest of your life? How do we touch on that, right? And they can
Mhm.
they can talk to you about that as well. That's like completely free. It's like getting to know you and helping you out with like moving again. And anybody can
Mhm.
do that in like this physical exercise and movement world.
Mhm. So which I think
Mhm.
is pretty cool because there are a lot of people who are they'll narrow their focus on fixing the issue and instead of kind of like zooming out and saying like what's really in my control, because if you feel like your bones are out of alignment and you have to rely on somebody else, then it doesn't really feel like that's in your control. But and this is a touchy subject because I know people with back pain have a hard time finding comfortable sleeping positions, but high quality sleep plays a huge role in
Mhm.
chronic pain. Finding low load like gentle aerobics can be very helpful. So with if I come across anybody who's like my back hurts, I'm like, can you walk? I'm like, doesn't have to be fast, doesn't have to be intense,
Mhm.
just get out there and walk. And that can even, open up a door to actually, this is in my control.
Yeah. And like if some people like who like really rely on medication and stuff, it's like, hey, if you go for a walk, we release this um like I guess opioid type of medication in our brain and it's completely for free, right? It's like it's called endorphins. If we go for like a small walk and just do things that we like to do, we can release these happy chemicals or like feel good chemicals and it can calm down the whole body, which is like so interesting to hear. And that's completely for free as well. It's like yeah, it's crazy to hear. It's
Yeah.
like some people like, damn, I need medication from the outside world when like the body can produce it.
Mhm.
So,
Yeah.
Rachel, we are coming up on, I just kind of assumed most of these episodes would probably be around 30, 35 minutes. So, the thing that I want to wrap up with is what would you say to someone who might be listening to this who maybe has a similar story as kind of going through like I guess the thick of it in terms of kind of being down and a little bit hopeless on what looking for like how to overcome their own back pain. What would you say to somebody?
Yeah, I think probably, you know, get clear on your goals. If it's that, you have, lifestyle things that you're not able to do, or if it's lifting or both, but like then try to find, a provider to help that really understands those goals, because sometimes, we just get, and to be fair, like there's a lot of roadblocks, like, oh, insurance, somebody, or you need a referral. So there can be roadblocks to finding a provider, of your choice. But if you can find somebody that really understands your goals, because not all providers are the same, and they're not all going to really understand how it's impacting your life. And I think it just makes a big difference to find somebody that aligns, with what you want to see as far as your treatment outcome. Because if you go see someone and they're like, stop doing everything, it's just going to make things worse. The anti-fragile mindset is so important, and I think that it's not very mainstream, sadly. But yeah, don't lose hope. Find find somebody that you mesh with as far as your lifestyle and activity goals, and then um, go from there. Yes.
Yeah,
Awesome.
it's like somebody that wants to focus on a whole person rather than focusing on just the problem,
Yeah.
the quote
Right.
unquote problem, whatever that might be.
Right.
Mhm. Yeah.
Yeah.
Well, cool. Is there I know that was, I just said, is there anything else you want to add? But is there anything else you want to add before we say bye to Rachael?
I don't know. Not. I
No.
guess not. I guess not.
Well, can you sit at the park
Yeah.
bench now?
Yes, I can. I can tolerate it much better than I used to. There's still like a limit, where if I'd been doing it a lot, I'm like, oh, that's probably too much. But yeah, it used to be that I really couldn't sit for like 5 or 10 minutes, and now I can sit for an hour or so, without too much flair. So yeah, totally.
Do you ever like pass by old park benches and you kind of look at
You're
them
like,
with
oh,
disdain?
that's where it was. Yeah. I mean, in my defense, a lot of these like were not designed by people who have seen a human body. So I mean, the expectations are low.
Mhm.
Yeah.
Well, awesome. All right. Well, Rachael, thank you so much for spending some of your Thursday with us, and thanks. Yeah, hope you have a great rest of your day.
Thanks for having me. I'm
Hmm.
honored to be the
Thanks,
first
Rachel.
guest.
I think it's fair to say we'll post this. This was good enough. I know you were worried about it, but yeah. All right. Take care.
Okay, you too.
Bye.
Bye.
Okay, bye.
Well, that was fun. So I really enjoyed hearing Rachel's story. Just obviously, talking about relying on people and those hands-on therapy treatments. So we touched on it a little bit about like why we think those are still important. What would you say to Andrew? Andrew, what would you say with somebody that is like that's the only thing that they do?
Ooh, if it is the only thing that they do,
Hmm.
it's like at least for me, it's like, what about the rest of your life, right? It's like, if that's also really important, shouldn't you look for somebody or have somebody to, I guess, work something out to like get back to doing things you want to do? It's like, are you truly living if you're just like trying to get out of pain, or is that more so just like a surviving type of thing and you're just floating along, just looking for like the next little pain relief thing, right?
Yeah, no, I think that hits the nail on the head. And I would say if you're somebody who is if you're like, oh, this is the only thing I do, maybe start to look at it a little bit more objectively. That like there are things you might need to add. Like, don't get rid of the things that are helping you right now, but that objectively take a step back and be like, um, hmm, how long have I been doing this for? And is it really better? Because if it's been 6 months, if it's been a year, there's a good chance that you might need to sprinkle in some other things because of it's probably not working. So, um, yeah. Anything else, Andrew, you want to add before we officially sign off on our first episode?
Hmm. Yeah, I'm just trying to think about like if there were any really cool nuggets that Rachel mentioned there.
I think the just like the biggest thing is her realizing, there's a tipping point where you go, man, I have to get help, because there is help out there. I mean, there's a lot of people that have back pain, and there's a lot of people out there. And I think objectively looking at somebody who doesn't have these narratives that are making you feel fragile. Like if you hear somebody who's telling you like, don't do XYZ, really dig in and be like, well, why? And just keep
Yeah.
asking why until you can start to go, well, your reasoning, I'm not totally sure makes too much sense. Like she said, the nugget I would say is she was like, well, wait a second. I've been deadlifting for 20 years. Why all of a sudden?
Should I avoid it, right?
Right.
Yeah.
So,
So I was gonna mention something along the lines of that as well. It's like if somebody's recommending you to avoid something that's like so important to just like being a person and moving around, just doing normal people stuff in life, it's like something's like it sounds fishy. It's like
mhm,
surely picking things up off the floor. It's like we should be able to do that in some
mhm.
capacity, right? And just
Yeah.
finding somebody to help guide you to get back to doing that. It's like that's super important because like yeah, yeah, you
Yeah.
always pick like being human is to like pick things up and move things around, right? It's like pretty hard to avoid that 24/7.
Mhm.
And if you are avoiding that, it's like now it's yeah, it's like how you functioning. It's like are you really functioning to like a high level?
Right. And so I want to be careful, because a lot of people are going to be at different stages in their like where their symptoms are, how flared they are, what they can actually do. And in Rachel's case, it was lean into kind of, because it was more muscular, maybe more ligament strain. It's like we need to lean into that a
Yeah,
little
it's
bit. And
exploring it.
for
Yeah.
some people, right? So you'll see online people doing Jefferson curls, which, if you don't know what Jefferson curl is, it's when you basically forward flex your spine all the way, and you essentially are holding a weight or body weight, and the entire spine will experience as much flexion as you can do, which for some people is not going to be an issue at all. So when we say, oh, somebody says don't deadlift, just go start deadlifting, find a provider that can progress you in a logical way that's not going to set you back. Like I read on a Reddit, somebody was like posted a video of someone doing weighted Jefferson curls, and because everything on the internet is so readily accessible, they went and tried it, and they're like, it set me back like a month. So,
Yeah.
you know, everybody's a little bit different. So there's an
Yeah, I think
acceptable.
that's like the importance of like a healthcare practitioner, right? It's like a movement specialist can guide you. It's like, okay, this is like probably the correct step for you in this moment in time. They're able to individualize and go, okay, at this moment in time, let's deadlift or hinge or pick something up, trying or trying this specific technique for now. But
Yeah.
in the long term, it's just like, okay, maybe right now you might have to do like a um, just like lifting stuff off a high box, but maybe in a few months' time, you're able to deadlift again off the floor.
Hmm.
But I think,
And
yeah, it's just a spectrum of like
yeah,
how intense or how easy something can be.
right. And of course, we could sit here and talk about like every intervention, but the last thing I'll say is the strategy of like pacing, right? So if lifting one object up, it if you have ridiculous symptoms, lifting up an object one time sets off just a smidge of a flare, but you go lay down for 5-10 minutes in between maybe repetitions, and it comes down, and you're feeling better. Like there is some wiggle room to expose you to certain movements, but yeah, it's really a matter of finding the right help. So, well, cool. That was I think a great first episode. So we'll end it on that note, and we're excited to continue to provide hope for people who are feeling like the medical system has quote unquote stabbed them in the back, which I know sounds really really bad. It feels like you're left in the dust, but sometimes being on Reddit for the last like year has shown me there are people who are really feeling like I have no help and no hope, and so we're hopeful that we will get more and more guests who have conquered back pain, because there's definitely people out there who have. So, all right, until next time, thanks again for joining me, Andrew.